Every clinical interaction takes place within a defined perimeter known as a scope of practice. This scope dictates the exact legal actions a counselor can execute. Credentials establish a legal threshold, defining precisely what a professional is qualified and trained to do when treating a vulnerable person. For chemical dependency counselors, this operational scope is highly specific. It does not grant authority over a client's general mental health. Instead, the Center-EPIS scope requires the rigorous assessment of substance use disorders. Alongside assessment, the scope strictly contains the direct, specialized counseling of those particular substance use disorders. All clinical actions, decisions, and therapeutic interventions must stay permanently within the limits set by the counselor's specific state license or certification. This scope acts as a calculated perimeter, designed to keep the therapeutic relationship focused and safe. Operating within this designed boundary helps prevent harm to clients, while insulating the counselor from the legal liabilities associated with practicing without a license. This circle illustrates a counselor's operational scope. That dot outside represents a client need exceeding the professional's training, triggering a mandate to recognize clinical limits. When a problem falls outside these limits, the immediate protocol is to refer them to an appropriate specialist. This requires understanding strict exclusions. First, chemical dependency counselors cannot diagnose depression, anxiety, or any conditions outside of substance use. Second, counselors cannot attempt to treat those external psychological or medical conditions, even if they strongly suspect their presence during a session. Third, there is an absolute prohibition on prescribing, adjusting, or even advising on a client's medication regimen. Fourth, counselors must never conduct psychological testing without the specific administration training and credentials required to interpret those results. This leads to a critical teaching maxim. If the presenting problem is not substance use or abuse, it inherently warrants an external referral. Practicing beyond this rigidly defined scope is not a minor error in judgment. It transforms a simple ethical lapse into a legally perilous violation. While clinical limits are publicly defined by law, the actual work of ethics relies on an internal, ongoing engine of personal professional responsibility, maintained long after the client leaves the room. This responsibility requires actively expanding clinical competence through mandatory continuing education, ensuring skills do not stagnate over a career. It dictates a strict requirement to ensure all provided services conform entirely to a complex web of federal, state, and local regulations. It also mandates a professional obligation to represent one's own credentials and qualifications with absolute honesty to clients, employers, and the public. Counselors hold an ongoing duty to actively identify and avoid any operational conflicts of interest before they compromise a therapeutic relationship. Because isolation breeds error, professionals rely heavily on clinical self-assessment tools to uncover personal blind spots before those blind spots result in client harm. Real professional integrity is built less during dramatic public ethical crises and more in the unwatched moments, like executing entirely accurate documentation when nobody is auditing the file. The credibility and reputation of the entire chemical dependence profession rests heavily on how counselors behave when they are completely alone. To reason through dilemmas, counselors rely on 6 foundational ethical principles. Autonomy respects the client's right to self-determination. Beneficence actively promotes well-being. Non-maleficence means, above all, do no harm. Justice treats clients equitably. Fidelity maintains trustworthiness, and veracity requires strict, unyielding honesty. These principles often conflict in practice. Mastering them replaces vague, instinctual moral feelings with a highly defensible, structured clinical framework. Professional boundaries are strict limits, keeping therapy focused on the client. A boundary crossing is a minor departure, requiring self-reflection. Left unexamined, it shatters into a harmful boundary violation. Additionally, dual relationships, like acting as a client's employer, create dangerous, tangled conflicts. These secondary relationships create severe conflicts of interest that inherently cloud clinical judgment and compromise the focus of the therapy. While some overlapping relationships require careful management in small communities, others carry an absolute, non-negotiable prohibition. Any sexual or romantic relationship with a current client is never acceptable under any circumstances. Internalizing this structural vocabulary is the only way a counselor can safely navigate the ambiguity of real-world clinical interactions without harming those they intend to help. Ethics is deeply woven through every screening, session, and referral, supporting every other clinical and diagnostic competency. Proper ethical reasoning requires the careful weighing and balancing of conflicting principles in real time, rather than relying on blind mechanical rule following. Maintaining crystal clear professional boundaries is the only reliable way to prevent minor, everyday crossings from slowly sliding into catastrophic clinical violations. When dual relationships are truly unavoidable, especially for counselors operating in rural areas or tight-knit recovery communities, they demand high transparency, strict supervision, and rigorous management. By utilizing a structured decision-making framework, anchored heavily by thorough documentation and regular peer consultation, counselors can turn moments of uncertainty into defensible protocol. Recognizing one's own clinical limitations and consistently referring clients out when their needs exceed the established scope of practice protects the integrity of the entire healthcare ecosystem. This everyday integrity and strict adherence to scope are the primary factors that sustain a counselor's career and the credibility of the profession.